how does Ireland compare to other Western European states with regard to screenings currently being carried out and plans for return to screening programs? And if it's unfavourable, do you know why?
So we've tried to find this information. We've been using our European networks to try and get good information, but it's a bit patchy. We know that in the Netherlands that screening has resumed there on a priority basis, though. So they have colon, breast, and cervical cancer screening. And the first case of COVID was diagnosed in the Netherlands on the 27th of February. So the invitees are being prioritised on the basis that first clients who received their initial invitation before March 16th but had their appointment cancelled have been re-invited, followed by the clients that should have been invited after this date. And in Portugal, again, the information isn't totally clear, but in the central and southern regions of Portugal, breast screening has been or has resumed since mid-June, and bowel and cervical have returned, but we don't know what date that happened. So, in terms of Ireland, like we've said previously, we really do want breast and bowel screening to return as soon as possible. And if the reason that cancer screening hasn't returned is because of capacity issues, then it underscores the point that I think both organisations have been making today, that there needs to be real, substantial, sustainable investment in capacity so that we're able to ensure that people get access to healthcare and cancer services as soon as they need them, and that will ensure that we limit the number of excess deaths and that we give people a really good opportunity to live a healthy and a good quality of life.
If I could ask a very simplistic question, and perhaps it's overly simplistic, which is going to result in a greater mortality, do you think, COVID-19 or the response to COVID-19?
The excess mortality at the moment is not that high, and that is only going to be something that we can evaluate as the evidence comes in. I am concerned that we are looking at our health services as if this crisis is because of COVID-19. We had a crisis. COVID-19 has made it worse, and that's why we have to take such significant and huge steps at the moment in terms of investment, and no more, planning. There are a myriad of plans on health. We just want some investment based on clinical evidence and patient need. So I think I don't think we could answer that question on mortality, but we would be, unfortunately, of the view that mortality will increase at a higher level than it would otherwise have done. But mortality is increasing within our health services because of the capacity issue anyway.